I spend a lot of time on my iPad, and I never knew that there was an app out there that would save your eyesight. I thought it was just for Facebook and, playing games and that kind of thing. But for something like this, it can help you, and it's just a simple app. My name is Peggy Logan. I'm over 60. I work in the accounting field, so my vision is very important to me.
So I'm Dr. Houston. I'm a retina specialist with Florida Retina Institute in Orlando, Florida. I did my residency at Bascom Palmer Eye Institute in Miami, Florida, and my vitreoretinal surgery fellowship at Wills Eye Hospital in Philadelphia, Pennsylvania. I've been very interested in digital health solutions and how we can utilize them as physicians for our patients. I like the aspect for home monitoring of having continuous monitoring of a patient's parameters. For ophthalmology, it's a no-brainer to start with vision testing.
I was getting to the point where I was having trouble seeing the road signs going down the highway. But we enjoy traveling, so I really wanted to see those road signs. And so I went to the optometrist for a regular eye check, and he discovered that I had something going on with my eyes, but he wasn't sure what. And then I came to see Dr. Houston at the Florida Retina Institute. They found that I did have a macular degeneration that was dry in both eyes. They sent me home with the My Vision Track test to do at home, and 27 days later, the test sent an alert to him. They found that my left eye had drastically changed, and it was now wet macular degeneration.
Patients with dry macular degeneration, usually, we see them standardly every 6 months. And I would find that probably less than 50% of people would adhere to testing with Amsler Grid.
By having the vision test, they're probably going to be able to save my eyesight, which otherwise I probably would have lost sight in my left eye because my next appointment was not for 6 months.
Dry AMD, kind of like a ticking time bomb. We never know if it's going to change. It may never change to wet. However, I have patients that it changes a month later, 6 months later, 2 years later. We just never know when it may change, if it's going to. With patients with wet macular degeneration, it's even more important because sometimes when their first eye, they've waited and they already have advanced disease in that eye, and we're doing treatments that maybe are keeping things stable, but they may still be legally blind in that eye, but yet their other eye is still good, may see 20/20 still, have some dry changes in that eye. And that's going to be the patient it's going to be even more important to do home monitoring because that's their remaining good eye, and that's the eye that's going to allow them to continue to drive, see their grandchildren, and keep them independent in their lives.
Thanks to this app, I will be able to travel more, and enjoy our retirement, and be able to see this great country that we all live in.